It's well known that public stigma is a huge hurdle for those with a mental illness. But are Australia's doctors and medical professionals just as guilty of discrimination? A new report obtained by 730 reveals disturbing complaints of doctors failing patients. Even the nation's peak medical body admits there's a problem. Some patients just aren't getting the care or the respect they deserve. Hayden Cooper has this report.
In any given year, up to 4 million Australians fight a mental illness. It's a path that many are forced to walk, and many are forced to walk it alone.
It's just good to being able to talk to you about it anyway. Being able to talk about it in general.
Oh, anytime. That's what friends are for.
Brisbane woman Alex Goulash has endured psychotic episodes and depression over many years.
The sorts of things that happened to me were pretty typical of psychosis, becoming paranoid, and then that turns into fully blown delusions.
But her lowest moment came when seeking medical help for what later turned out to be a physical, not mental illness.
Because I had the history of mental illness, it was immediately assumed that I was mentally ill and needed to be in a psychiatric unit and have psychotropic medications. I was in a delirium, a very confused delirium, and I can remember at different times asking people, can you tell me what's happening? I don't understand what's happening. I'm sorry, I'm getting upset. And this is what I'm talking about, and this is why I'm here. Because of the trauma it causes you. You have no idea what I experienced in that psychiatric unit, unless you've actually been in one. They considered me to be non-compliant, that I was refusing treatment. I had my arm bent up behind my back so far and so painfully that I screamed out loud at the top of my lungs. And I've never screamed like that, I don't think, in my life. Not in pain, anyway. And then I was told, then get up and walk.
So how common are stories like these, where even medical professionals discriminate against mental health patients?
And why should there be such a stigma around mental illness? And it's really just ignorance and fear.
Advocates like Michael Burge believe it's all too common.
We've been all subject to or on the receiving end of some condescending, patronising, tokenistic, intimidating, discriminating, institutionalised attitudes.
But certainly it was the hospital just came through really starkly.
In a landmark new study, the Mental Health Council has set out to quantify the problem in a survey of 400 patients and 200 carers. 29% of patients report feeling shunned or avoided by health professionals. More than a third were advised to lower their expectations in life because of their mental illness. And this applied mostly to patients with schizophrenia, personality disorder, post-traumatic stress disorder and depression. Almost half of mental health carers believe doctors behave differently when they discover a mental health history. GPs cop the most complaints of poor care, followed closely by psychiatrists, but psychologists fare the best. The report includes the traumatic personal stories of mental health consumers.
I'm very nervous about sitting in a hallway with mental health plastered against the wall in a public area.
I've been in the emergency area of the hospital and overheard a treating doctor asking another doctor if it was a full moon.
The staff attitude towards me changes when they realise I have a mental health history. It's as if they think they can catch it off me.
We sat in a room with psychiatrists telling our 18-year-old daughter she should stop expecting anything from life because she has a mental illness.
The levels of stigma being received by mental health consumers and also being observed by mental health carers is that stigma is at least at the same level being received from the general community, and on some occasions it's actually higher. So that's really quite disturbing for us.
Countless number of times I've heard stories like a consumer's been told that you're never going to get out of this hospital, you'll never be off medication, you'll never have a real job, you'll never be able to look after yourself properly in the community without support. In other words, they're just giving the prophecy of doom to people that are going there for help and not instilling any hope in them at all.
The first failing is acknowledging that there's a problem.
The Australian Medical Association, through its president, is upfront about the system's failures.
It's a small number of people and it's a voluntary survey, so you will get the extreme views, but some of those views have revealed a problem that we need to respond to. We need to recognise that stigmatisation by providers actually impairs that clinical working relationship and impairs the outcome.
The Mental Health Council will now survey professionals to find out if more training would fix the problem.
It's terrible, and I think what we need to do is try and work out why as a first step and then move from there, but certainly it's not acceptable.
There are a lot of good people that work in mental health. It's not.
As for Alex Goulash, she hopes her experience can help patients and doctors alike and fix the failures in the way those who need help the most are treated.
What happens is they immediately see you within that filter. You've got a label on your forehead as being a psychiatric patient, a person with a mental illness, and they see everything within that context.
The people with a lived experience may forget exactly what you said to them. They may even forget exactly what you did, but they will never, ever, ever forget how you made them feel.